Hi, Tam here. So today I'd like to talk to you about the pain scale. Now, what is the pain scale, you might ask? Well, if you've ever been to a hospital, in the ER, in the emergency unit, and you're in pain, right? So as you arrived in the ER, before you saw the doctor, the nurse asked you some few questions, right? And these questions are being asked to assess the level of severity of your emergency. Do you need to be seen immediately, or could you wait a bit? So one of the questions there is with regard to the pain scale, and they will ask you, grading from 0 to 10, how much pain do you have? 0 being no pain, 10 being the maximum level of pain. And then you'll be left to wonder, what? I don't know. 5, 10, I don't know. The pain scale is completely useless if you ask me, right? And I wish all ERs in the world would just do away with that, right? What's the point of asking a patient in pain to grade his or her level of pain from 0 to 10? Bearing in mind that's an imaginary scale, right? With completely virtual numbers that could mean different things to different people, right? So 0 to 10, how much pain do you have? I could take a hammer, doing some woodwork, and try to hammer down a nail into a plank of wood, hit my finger and break my finger, right? So I'll go to the ER. I might have a high tolerance of pain. He might have a low tolerance of pain. So we both have a broken finger at the exact same spot, at the exact same time, but our level of pains are completely different based on our previous experiences, right? So, the pain scale is not a unit of measure, right? It's not like, you're telling me that, my child had a temperature the whole night and it was quite high. And then I ask you, so how much was it, what was the highest? So, the highest was 39.9 Celsius. It's a unit of measure. I know exactly how high your temperature was, right? But now, how much is the pain? Sometimes the nurse will come and we say, okay, this next patient there, her pain is 7 out of 10. Okay, good. It's a completely useless piece of information. First of all, there's different factors that are making this pain scale completely irrelevant, ambiguous, and, very, very, very subjective. Some people have a high threshold for pain. Some people have a very low threshold for pain. Right? So somebody might get a mosquito bite and be like, oh my God, it's so painful, please help, right? Somebody else might show up with a broken finger, right? His hand or her hand was caught between the door and the door frame. Somebody closed the door and the finger is shattered. But that person might be very, very strong and tolerant of pain. So the mosquito bite lady might say, oh, my pain is 10 out of 10. And the smashed finger might say, oh, my pain is 3 out of 10. Right? So how do you know who's in pain, who's the most in pain? How is that number going to help you in terms of choosing the painkiller, choosing the dose of the painkiller you're going to give? Then there is other symptoms like depression. Somebody with depression, patients that are depressed tend to have a lower tolerance of pain. Alcohol. If a patient comes in drunk, wasted, severely alcohol intoxicated, even a stab wound on the face, they might not feel that much pain, right? Because they're already numb by the alcohol. I mean, I've seen many patients, man. They're brought in by ambulance, they're completely wasted. They've been stabbed on the face, they've been hit with broken bottles on the face, they've got deep gashes and lacerations, they're bleeding. And yet, when you look at them, I mean, you can clearly see that they're not too concerned about their injuries. In fact, when you tell them, listen, this is bad, I'm going to have to put some sutures there. You know, you've got multiple lacerations, it's very deep. I can actually see the bone of your scalp. Then they act surprised. Oh, really? I've got wounds on my head, right? So depression, alcohol, drugs, there's so many different factors. Some patients are very needy, the type of patients that come to the ER every single week or sometimes twice a week. They come to the ER because they've got a blocked nose and they think they're going to die. They've got a little bit of a nosebleed for 60 seconds. They're already in their car, they jump in their car, they come to the ER. I've got a nosebleed, and they think it's the end of the world, they're probably going to die. Maybe it's cancer, maybe it's something else. So such patients, when they come with a little bit of pain, maybe they've got a sore throat, right? And you ask them, so how much is your pain on a scale from 0 to 10? 10! Right? So the scale is completely subjective. And actually, it should be abandoned. Worldwide, there is no room for such arbitrary scale. A scale that means different things to different people. Right? I mean, if you want to be scientific about the scale, right, you would have to, for every patient you see, if you're going to ask them, so how much is your pain? 0 being no pain, right? Now, I'm going to prick you with this needle. Oh, well, that's 1. Now, I'm going to punch you in the ribs. Boom! Oh, that's 2. And you go up gradually, right? Now, I'm going to smash your toes. Ah, that's 5. Right? Now, let me grab my gun. I'm going to shoot you in the shoulder. That was 8. Right? Okay, you see this hot needle there? I'm going to pierce through your eye with that needle. That was 10 out of 10. Now, talking about your broken finger and, in reference to the scale I've just used on you, how much is your pain? I would say 2. I mean, you see, it's ridiculous, man. It doesn't make sense. And the other thing as well. The other thing is that, personally, right, whenever I hear nurses talking about, so how much is your pain? And they're talking to a patient in pain, you can clearly see, man. I mean, this guy or this woman, man, this patient's got a broken ankle. It looks broken. It seems quite obvious based on the history as well. Looks like it's a broken ankle. It's deformed. It's swollen. I mean, you can see, right? So that looks like a broken ankle. It's very painful. The person comes limping in like, oh my God, please help me. I was in a car accident. I think I broke my ankle. And you're sitting there with your iPad, and you're like, okay, we're gonna help you, but on a scale from 0 to 10, 0 being no pain, and 10 being the maximum amount of pain, how much is your pain? You're like, please help me, it's sore. I understand it's sore, and you're gonna help you. But I need to know, how much pain do you have on a scale from 0 to 10? I don't know, please, man. Oh my God, it's so painful. It's so painful. And I think my wrist is broken. Look, I can see the bone. It's sticking out. Oh yeah, that's terrible. The bone is sticking out. So how much pain do you have on your wrist? Would you say it's 5, 6 maybe? I would say that's a good 7 or even more. I don't know, please, I've got a broken ankle, I've got a broken wrist, I can't move. Oh my God, I've never had so much pain in my life. Please help me. I understand, it's very painful, but I just need to know, and I need to grade your pain. So, 7, 10. Yeah, 10. 10 on the ankle, 10 on the wrist. It's horrible. 10 on the ankle and 10 on the wrist. Really? I mean, I would have thought that, you would have more pain on the wrist because I can see the bone is sticking out even more now. And then on the ankle. So I would have imagined maybe 9 on the wrist and should we say 8.5 on the ankle? Or maybe 8.4? Maybe 9, right? Well, no. Let's say 9.5 on the wrist and 7.5 on the ankle. Yeah, man, 10 everywhere, man. 10 everywhere. Please help. Okay. Let's not get carried away. I don't think it's a 10 here, right? I mean, it's broken. But 10 would not be, 10 could be worse than that, right? I mean, if I take a machete there and chop off your hand, I think that will be a 10, right? Right? Or if I take your hand and I put it through a grinder, that might be a 10, right? So that's not the same. So I don't think that's a 10. I'll give you 9. You know what? I'm going to give you a 9.2. Should we say 9.2 then? Should we say 9.2 then? Whatever you want. 8, 9, whatever you decide. I need to see a doctor, please. So, I mean, you see my point. I mean, the pain scale is useless, right? We need to stop using it. I mean, to my fellow doctors here, we need to stop using the pain scale because it's not helpful at all. And I feel personally that, it's not an act of compassion. When somebody is injured coming to you in severe pain and you start asking them, so let's grade it. Should we say 4? Should we say 5? Or maybe 6? It doesn't really help. It's insensitive. So much more important than the grading of the pain. What really matters is the location of the pain. It doesn't matter if the pain is 5, 6, 7, 8, 9, or 10. What matters the most is the location of the pain and the mechanism of injury. Let me explain that. You're going down the stairs, you fell, and now you've got a broken ankle. You come to the ER, and they ask you, so what kind of pain do you have on a scale from 0 to 10? And you say, oh my God, it's so painful, 10 out of 10. All right. So what? Does it make it urgent now? And then right next to you, there is another patient that comes in. And he's holding his chest. I mean, his or her, I'm using his as a universal his, right? So he's holding his chest. And he's like, I've got this pain, I'm not feeling okay. Can I see a doctor? And then you ask, so how much pain do you have on a scale from 0 to 10? And then the guy say, well, it's not so much pain. It's like the pressure, it's... I understand, sir, but grade it from 0 to 10. Give me a number, sir. Okay, if I have to give you a number, I would say maybe 4. I would say it's 4. But it's pressure, not really pain, like pressure, like somebody is sitting on my chest, and squeezing my heart. and this pressure is going up to my neck, and it's going to to my left shoulder as well, and I feel that my left arm is getting numb. It's not painful, but it's kind of numb. I can't really move my arm. I just feel such discomfort, you know. All right, let me get this right. So the pain is just fall, basically. That's what you're saying, right? It's just pressure. It's not really painful. Okay, you sit there, relax. Johnson, give him an orange juice there, right? And I take care of that ankle before, and we'll come back to you, right? And I mean, you understand. So this guy is having a heart attack, but he said 4 out of 10. And because the ankle guy said 10 out of 10, now the real emergency has to wait for the guy who could actually wait. I know it's an extreme example, right? And in any ER, somebody with chest pain will always get priority, but it's just an example, right? Anyway, just an opinion, man, my take on the pain scale and how irrelevant it is in medicine, But who am I? Just a humble doctor giving you his opinion, In the end, if you're a doctor, you do what you want to do, If you're a nurse, if you're a paramedic, if you're a medic, basically, right? Do what feels right for you, right? But as far as I'm concerned, I've never used the pain scale, and I'll never use the pain scale because it's a complete waste of time. Yeah, no pain scale for me. Cheers.